I went through treatment for addiction during the COVID-19 shutdown. And during that time, I had 7 months sober. I was 7 months into a 12-month treatment plan when the shutdown occurred. Uh, the effects that I directly suffered from the sudden stops in communications and the halting of all gathering, the shutting down of our program because of this, were depression. I got really depressed there for a while because I didn't have that support system that I had had 8 hours a day, 5 days a week anymore. Our classroom time ended up getting commuted to like Zoom, and it was like an hour once or twice a week, and that was it for the first, I don't even know, like couple months into the shutdown. During the time that we were there, it was hard to stay connected with our peers, uh, mostly because a lot of our peers relapsed during the shutdown because they too were suffering from depression. They weren't getting communicated with their peers. They weren't having that support system that we needed. And then there were people that died, just dead. Here one day, gone the next. And you couldn't even go say goodbye because COVID had made everything impossible to connect with people, especially at the beginning of the shutdown. There was a lot of, I guess, we didn't know a lot of what was going on, and there was some hysteria there and paranoia, and mostly for a good cause because COVID's bad. But mainly like just the isolation that people went through, even if you didn't have a drug problem, was debilitating to people's mental health. Add the fact that you have an addictive personality disorder, and it's a recipe for death, overdose. Um, I would say that the most effect that COVID had when it came to communication, at least in the mental health world and in the substance use world, would be the lack thereof. It completely debilitated and crippled the recovery community at the beginning. Um, Overdose rates are twice, if not three times, in some localities what they were prior to the pandemic. And a lot of the efforts that were made to start getting help for recovery pre-pandemic, um, were all put to the side, and it delayed help that people like me needed.